a question. How hard is it to get arms done? I have skin hanging. Right, Mrs. G. It's not hard to get arms done, Mrs. G, but the problem with, I always say to people, in terms of body contouring, if you're Googling, so when people have lost weight, there's certain areas that are a problem. The arms are a problem, the skin hanging, the breasts, the face, the tummy, the legs, especially the thighs. But if you're kind of Googling these sorts of body contouring surgery to tighten the skin, there's a disproportionate amount of stuff written about the face, facelifts, breasts, breast lifts, tummy tuck, compared to thigh lifts and arm lifts. There's not a huge amount about thigh lifts and arm lifts. And the reason for that is because the scarring is a bit more, or maybe even a lot more obvious with an arm lift and a thigh lift. With face lifts, breast lifts, and tummy tucks, we can kind of hide the scar. Facelift, you sort of hide it in front of the ear and behind the ear. Breast lifts, you hide it when it's hidden kind of in the bra, so you can't see it in the bra. Tummy tuck, we try and hide it in the underwear. But arm lifts and thigh lifts, you can't really hide it because the spare skin with an arm lift usually goes down to your elbow. And so whilst we would love to give you a short scar, often if there's a lot of spare skin, the scar goes down to just above the elbow, and that can be an issue if you've got short sleeves on. And sometimes people say, I hate my, I don't care about scars, I hate my arms, I can't show my arms in public. Well, if we give you a scar, you might hate the scar, and you might still not be able to show your arms in public because you hate the scar. So you've got to say, is it worth doing the surgery if you're going to have something that's cosmetically bad, and you're still going to want to wear long sleeves? Well, what's the point in having the surgery? So it is not as common. So I would say it's not kind of hard to get arms done, but it is not as common an operation as the other kind of operations. And certainly when I talk to people, I'm not doing, well, first of all, Mrs. G, I'm not doing these sorts of things anymore. I'm not doing the GA cases. But when I do talk to people about things like breast lifts, arm lifts and thigh lifts, I'm not very positive. Not because I don't want to do it, but because I want to give realistic expectations to patients, because I want to have a happy patient and I want them to be aware of what outcome they can expect. And if I can kind of talk someone out of it, I'm okay with that, and I will show them photos of the scar, and we aim to hide the scar so you can't see it from the front and the back. It's kind of in the neutral position of the arm, but certainly if you put your arm up, you can see it. Same with your legs. When you're walking, it'll be okay, but if your leg sort of tilts to the side, then you can see it. So it is something that you might feel uncomfortable with, and so it might affect your decision on whether an arm reduction is for you. So it's really, in my experience and in my hands, arm reduction is really good for people who've got a really big excess of skin there, where it's kind of getting in the way and it's hard to find clothes, etc., because then it really will help to contour the arm. But in terms of its pure cosmesis, it has to be balanced against the scar, which usually fades, but it doesn't fade to invisibility. It fades to a kind of skin colored line, and it can take many months for it to get there. And even when it's faded, it can be visible, if you like, and you might kind of know there's something there. So I would say arms are not as popular as the other procedures. I don't think they're any more difficult to get. I just think they're not as popular because of the scarring. I think it's something that puts a lot of people off. And as I say, from a surgical point of view, that's fine if you're put off by it, because maybe it's not the right thing for you. Maybe it's it's a balance of like, what's the worst? So the worst of not doing anything is still having the skin, and the worst of doing it is kind of having a scar, the cost, the risk, the complications, the operations, the downtime, and all that. So that might be outweighed by the actual leaving it, so it might be a reasonable thing to leave it. It might not, you might hate them so much that you're happy to take on those negatives, but it's just about being informed so you can make an informed decision. It's all about informed consent. So you don't have it done and think, oh crikey, look at the scar, I wish I'd never had it done because I still can't show my arms and it's cost me all this money and I've got a big scar. We don't want that. No one wants that. So we want people to say, wow, that's brilliant. And to be honest with you, when you do it, patients are really happy. you know, it isn't one of those ones where thigh lifts. Anyway, I'm digressing a bit. Thigh lifts kind of less so. I find thigh lifts, personally, I find patients are perhaps not quite as happy, but arm lifts, I do find people are happy. But maybe that's just